pneumonia and diarrhea are the two leading causes of death for children under 5 years of age. And together, these two causes account for 29%, or nearly 1/3 of deaths among children under 5 around the world.
For China, it's estimated that 315,000 children under 5 die, of which 14% is due to pneumonia and 3% is due to diarrhea.
Ethiopia's biggest effort, and I think the chance to be successful, is to scale up community-based care at the health post level.
We're calling for greater commitment, attention, and concerted global action on behalf of the most vulnerable children.
A meeting with 700 global leaders from government, the private sector and civil society will start in Washington, D.C. tomorrow to kickstart a push to reduce child deaths across the world from diarrhoea and pneumonia. A new report from the United Nations Children's Fund, UNICEF, claims that if the 75 countries with the highest under-5 mortality rate gave the poorest infants the same protection and access to medicines as the richest children in their countries, an estimated 2 million lives could be saved over the next 3 years. Ethiopia is in the top 5 countries listed in the report, along with India, Nigeria, the Democratic Republic of Congo, and Pakistan. Together, these 5 countries make up 50% of global child deaths by diarrhoea and pneumonia. I spoke by telephone to Director of UNICEF's health program in Ethiopia, Lu Wei, a Chinese doctor from Beijing, who explained to me how concentrating on these 2 diseases was the easiest way to reduce child deaths.
We are now, UNICEF and with other partners, are supporting the government to train the health extension workers to treat pneumonia and diarrhea. And they treat pneumonia with antibiotics and the diarrhea with zinc and ORS. This will certainly bring down the mortality from these 2 diseases.
Optimal breastfeeding, adequate nutrition, vaccination, hand washing with soap, providing safe drinking water and basic sanitation are key steps to preventing the diseases, but often missing from the poorest communities. Treating diarrhea with oral rehydration salts and zinc and pneumonia with antibiotics are simple and effective ways to deal with the diseases, but again not always accessible by the world's most needy children. The meeting comes at the start of a final campaign to meet the United Nations Millennium Development Goal number 4, to reduce by 2/3 the under-5 child mortality rate by 2015, a goal that is within reach for many countries, including China, that rates 7 in the list of countries with the most under-5 deaths from the 2 diseases in the UNICEF report. Although the mortality rate of under 5-year-olds in China has decreased by 73% since 1991, there are still nearly 300,000 child deaths a year, according to the report on women and children's health development released by the Ministry of Health last year.
There are vast differences in under 5 mortality between the economically well-developed east of China and the relatively underdeveloped west of China. To give an example, in Shanghai, the under 5 mortality is 5 per 1,000 live births, and in Sichuan province, the under 5 mortality is 8 times higher, it's almost 40 per 1,000 live births. So that is a huge differential, and so that means if, and this is also what the UNICEF report says, if we are able to provide the same level of services to the richest, that the richest enjoy, if we are able to give those services to the poorest, then we can reduce a lot of under 5 deaths. China is putting a lot of emphasis on trying to make sure that these differences, that these inequalities disappear, and the government, the central government, does that by funding health programs and subsidizing health programs in the West much more than they fund health programs in the East. So that is a really good way of kind of making sure that these inequalities disappear, these inequities disappear. And so if China puts even more effort in that and focuses that effort also on the issue of pneumonia and diarrhea, China could be a global leader in showing what it means if you invest in the poorest part of the population.
With 3 years left to go, there is much work to be done over the next 3 years if the fourth millennium goal is to be reached by 2015. Reducing child deaths from 2 easily preventable and curable diseases is an important first step. This is DJ Clark in Beijing for China Daily.